My name is Suprabha Shrimali and my roll number is 84. My topic is antiviral agents. Classification. First, drugs used against hepatic infection. Anti-herpes agent. Acyclovir, valacyclovir, famciclovir, penciclovir, genciclovir, foscarnet and idoxuridine. Second, drugs used against HIV infection. Antiretroviral agents. A. Nucleoside reverse transcriptase inhibitors. Zidovudine, stavudine, lamivudine, didanosine, zelcitabine, abacavir, emtricitabine, tenofovir. B. Non-nucleoside reverse transcriptase inhibitors. Nevirapine, delaverdine, efavirenz. C. Protease inhibitors. Secunavir, indinavir, ritonavir, lopinavir, nelfinavir, emprinavir. D. Fusion inhibitors. Enfuvirtide, maraviroc. E. Integrase inhibitors. Raltegravir. Third, anti-influenza agents. Amantadine, rimantadine, oseltamivir, zenamivir. 4. Other antiviral agents. Interferons, ribavirin. Anti-herpes agent. Acyclovir. It is a synthetic purine nucleoside analog that has anti-herpes activity. It is more effective against HSV1 and HSV2 than varicella zoster virus infections. Mechanism of action. Acyclovir is selectively taken up by herpes virus infected cells and activated to triphosphate derivative which inhibits viral DNA synthesis. It is available for oral, topical and IV administration. It is a highly potent anti-herpes drug. It has high therapeutic index with low toxicity to host cell. Its oral bioavailability is poor. It is poor bound to plasma protein, widely distributed in the body, freely crosses blood-brain barrier and is excreted in urine. Uses. First, genital herpes. Oral or intravenous or topical acyclovir is effective in genital herpes simplex infections. It is used for primary and recurrent infections. High doses of acyclovir are needed for recurrent infections. It reduces the frequency and severity of herpetic lesions. Second, herpetic encephalitis. Intravenous acyclovir is the drug of choice for encephalitis caused by ESV. Third, herpes simplex keratitis. Acyclovir is used topically in herpetic keratoconjunctivitis. Fourth, mucocutaneous HSV. Acyclovir is used orally or topically in the treatment of stomatitis, herpes labialis, and ulcer in the mouth. It is used intravenously in immunocompromised patients. Fifth, herpetic whitlow, male bed infection. Oral acyclovir is useful for the prevention and treatment of whitlow. Sixth, chickenpox. Acyclovir reduces the duration of illness if started early in patients at risk of severe illness and immunocompromised individuals. Herpes zoster. Acyclovir and valacyclovir are effective. Adverse effects. Acyclovir is usually well tolerated. Nausea, vomiting, diarrhea, and headache are the other side effects. High doses may cause neurotoxicity with tremor, confusion, disorientation, and convulsions. On topical use, it can cause irritation and burning. Idoxuridine. Idoxuridine is a thymidine analog that acts against DNA viruses. It inhibits viral replication. Idoxuridine is used topically for HSV keratoconjunctivitis. The adverse effects are local irritation, itching, pain, and swelling of lids. Anti-influenza agents. Amantadine. It is an antiviral drug that has anti-Parkinson effects as well. It inhibits the uncoating and assembly of influenza A virus, thus prevents viral replication. It is administered orally, well absorbed from GI tract and is excreted unchanged in urine. Uses. First, amantadine is used for the prophylaxis and treatment of influenza A virus infection. Second, for Parkinsonism. Adverse effects. They include anorexia, nausea, epigastric discomfort, headache, insomnia, confusion, hallucination, and hypotension. It is contraindicated in pregnancy because of teratogenic effect. Rimentadine. Its mechanism of action is similar to amantadine but has longer duration of action. It is administered orally, well absorbed through the GI tract, extensively metabolized and excreted in urine. Oseltamivir. It selectively inhibits influenza A and B virus neuraminases, thus interfering with the release of virus from infected cells. It is used orally in the treatment and prevention of influenza A and influenza B virus infections. Adverse effects are nausea, vomiting, and abdominal discomfort. For prophylaxis, 75 mg OD for 7 days. For treatment, 75 mg BD for 5 days. Zanamivir. The mechanism, action, and uses are similar to oseltamivir. Oral bioavailability is low. It is administered by inhalation. Adverse effects are bronchospasm, headache, and dizziness. It should be avoided in patients with airway disease. Antiretroviral drugs. Nucleoside reverse transcriptase inhibitors, protease inhibitors, and integrase inhibitors are effective against both HIV-1 and HIV-2. Non-nucleoside reverse transcriptase inhibitors and entry inhibitors are active against HIV-1. Nucleoside reverse transcriptase inhibitors. These drugs, after entering HIV-infected cells, are converted to their active triphosphate form by cellular kinases and competitively inhibit HIV reverse transcriptase. They get incorporated into the growing viral DNA and causes termination of chain elongation of proviral DNA. Zidovudine. Zidovudine is a thymidine analog, was the first antiretroviral drug approved for the treatment of HIV infection. It is the prototype drug of NRTs. Zidovudine is effective against HIV-1 and HIV-2. It protects the uninfected cells from HIV but has no effect on HIV-infected cells. Zidovudine is orally effective. It is well absorbed from GI tract, metabolized in liver by glucuronide conjugation, and excrete in urine. It crosses placental and blood-brain barrier and is excreted in milk. Adverse effects and drug interactions. Bone marrow suppression, anemia, and neutropenia are the common side effects. Nausea, vomiting, abdominal discomfort, headache, and insomnia are commonly seen during the initial stages of therapy. Long-term therapy may cause hepatotoxicity, myopathy with fatigue, and lactic acidosis. First, Zidovudine and paracetamol both are metabolized by glucuronide conjugation. Paracetamol competes and interferes with glucuronide conjugation of zidovudine. This leads to a rise in the plasma concentration of zidovudine and its toxicity. Second, azoles and zidovudine. Azole antifungal agent are hepatic microsomal enzyme inhibitors. They inhibit the metabolism of zidovudine. This leads to an increase in plasma concentration of zidovudine, resulting in its toxicity. Third, zidovudine and stavudine. They should not be combined together because they compete for intracellular phosphorylation. Zidovudine is used in combination with other antiretroviral drugs for the treatment of HIV-infected patients. It is also used for post-exposure prophylaxis and to prevent vertical transmission of HIV. Didanosine, stavudine, zelcitabine, lamivudine, emtricitabine, and abacavir. They are effective orally. Lamivudine is a commonly used agent in antiretroviral therapy because of its low toxicity and efficacy. Emtricitabine is one of the least toxic antiretroviral agents. Stavudine and didanosine should not be combined because of increased risk of peripheral neuritis, pancreatitis, and lactic acidosis. Adacavir can cause hypersensitivity reactions. Tenofovir, nucleotide reverse transcriptase inhibitor. It is a nucleotide analog of adenosine. It undergoes intracellular phosphorylation and inhibits viral reverse transcriptase enzyme, resulting in termination of chain elongation of HIV DNA. Flatulence can occur with tenofovir. It should be cautiously used in patients with renal disease. It is used in combination with other antiretroviral agents for the treatment of AIDS. Tenofovir and lamivudine are also effective against hepatitis B virus. Non-nucleoside reverse transcriptase inhibitors. Non-nucleoside reverse transcriptase inhibitors are highly active against HIV-1 but have no effect on HIV-2. Non-nucleoside reverse transcriptase inhibitors directly and non-competitively inhibit HIV reverse transcriptase enzyme. There is no cross-resistance with NRTIs. They are used in combination with NRTI in the treatment of AIDS. Adverse effects are skin rashes, fever, nausea, pruritus, and CNS disturbances with headache, confusion, insomnia, bad dreams, amnesia, etc. Nevirapine, delavirdine, efavirenz bind directly to reverse transcriptase enzyme and inhibit their function. Nevirapine. It is a highly lipid-soluble drug and is almost completely absorbed from the GI tract. It freely crosses the placental barrier and blood-brain barrier. It is secreted in breast milk. Rashes are the frequent side effect of nevirapine. It can cause hepatotoxicity. It is extensively metabolized in liver and excreted mainly in urine. Efavirenz. Efavirenz has long duration of action and is administered once daily. It is taken on empty stomach. It mainly causes CNS side effects. Rashes also occur with efavirenz. Protease inhibitors. They competitively inhibit the HIV protease enzyme, prevent cleavage of viral polyprotein to the final functional, structural, and enzymatic components of HIV. Immature and non-infectious viral particles are produced. Cross-resistance is common among the PI, but there is no cross-resistance with reverse transcriptase inhibitors. PIs are used orally with reverse transcriptase inhibitors in patients with AIDS. They are extensively metabolized in liver. Nausea, vomiting, and diarrhea are the common side effects. They also produce skeletal muscle wasting, lipodystrophy, insulin resistance, diabetes, etc. Dinavir. Nephrolithiasis and hyperbilirubinemia are also seen. Good hydration can reduce the incidence of nephrolithiasis. Nelfinavir. Diarrhea is an important side effect. Ritonavir. Ritonavir inhibits cytochrome P450 and causes a number of drug interactions. It inhibits both HIV-1 and HIV-2 proteases. Low-dose ritonavir is used in combination with other PIs. Boosted PI regime. Ritonavir inhibits metabolism of co-administered PIs, increases their bioavailability and half-life. Dose and frequency of administration of co-administered PI is reduced. Nelfinavir is not combined with ritonavir. Entry or fusion inhibitors. Enfuvirtide and maraviroc. Enfuvirtide prevents fusion of HIV-1 membrane with that of host cell membrane, blocks viral entry into the cell. It is administered subcutaneously. Injection site reaction like pain and erythema are the important adverse effects. It is given as an add-on drug in patients who are not responding to ongoing ART. It does not exhibit cross-resistance with reverse transcriptase inhibitors and PIs. Maraviroc is a CCR5 chemokine receptor antagonist. Blocks binding of CCR5 tropic stains of HIV to host cells. It is given orally. It is generally well tolerated. Adverse effects like cough, myalgia, arthralgia, diarrhea, and hepatotoxicity may occur. Integrase inhibitors. Raltegravir. Raltegravir inhibits integrase enzyme, prevent integration of viral DNA with host DNA. It is generally well tolerated. Headache, nausea, and fatigue may occur. It is effective against both HIV-1 and HIV-2. Treatment of HIV infection. Retroviruses contain RNA-dependent DNA polymerase enzyme. They cause selective depletion of CD4 cells, leading to a profound decrease in cell-mediated immunity. Hence, the infected person is prone to severe opportunistic infections, Kaposi sarcoma, and lymphoid malignancies. Objectives of antiretroviral therapy. First, to suppress HIV replication and improve immune status of the patient. Second, to prevent the emergence of drug-resistant virus. Third, to prevent opportunistic infections. Principles of therapy. Antiretroviral therapy regimen is used to achieve the above objectives. In ART regimen, drugs with different mechanism of action should be used so that they produce synergistic effects. Use of drug combinations also prevent development of resistance. Usually consists of a combination of two NRTI with a NNRTI or a PI. Criteria for anti-HIV treatment. ART should be started in all HIV-infected patients, irrespective of CD4 count or clinical stage. Patient with CD4 count of less than 350 or equal to 350 cells per mm3, and those with WHO clinical stage 3 or 4 should be started on ART. First line ART regimen: 2 NRTIs, 1 NNRTI. The preferred regimen is TDF plus 3TF or FTC plus EFV. Emtricitabine 200 mg OD, lamivudine 150 mg BD or 300 mg OD. Zidovudine 300 mg BD, tenofovir 300 mg OD, efavirenz 600 mg OD, nevirapine 200 mg OD. Regimens for HIV positive patients who have not received prior ART: TDF plus 3TC or FTC plus EFV, or TDF plus 3TC or FTC plus NVP, or AZT plus 3TC plus EFV, or AZT plus 3TC plus NVP. If NNRTI cannot be used, a combination of 3 NRTIs can be used. In cases of treatment failure, PI-based regimens are used. Example: NRTI plus NNRTI plus PIs, or 2 NRTI plus PI. Monitoring of therapy. Estimation of HIV viral load is preferred. Pregnant women: a combination of TDF plus 3TC or FTC plus EFV is recommended in HIV positive pregnant women. Prophylaxis of HIV infection. Post-exposure prophylaxis. Individuals who have had exposure which carries a risk of transmission of HIV need post-exposure prophylaxis depending on the risk of HIV transmission and HIV status of the source. Post-exposure prophylaxis should be initiated as early as possible, preferably within 72 hours of exposure. The preferred regimen of adult is a combination of TDF plus 3TC or FTC LVP for 28 days. Pre-exposure prophylaxis is administration of antiretroviral drugs prior to exposure to HIV for preventing HIV infection. Tenofovir plus emtricitabine is given. Other antiviral agents. Interferons. Interferons are protein produced by virus-infected cells and also by recombinant DNA technology. There are mainly 3 types of interferon, namely alpha, beta, and gamma. Antiviral activity of interferons is due to inhibition of viral penetration, synthesis of mRNA, translation of viral proteins, assembly of viral particles, and their release. They are administered by intramuscular or subcutaneous route or locally into the lesion. Uses. Interferon alpha is used for the treatment of venereal warts, herpetic infections in immunosuppressed individuals, chronic hepatitis B and C, and Kaposi sarcoma in HIV patients. Adverse effects. These include fever, headache, myalgia, skin rashes, alopecia, bone marrow suppression, cardiotoxicity, neurotoxicity, and thyroid dysfunction. Ribavirin. It is a synthetic purine nucleoside analog and has a wide range of antiviral activity. Ribavirin monophosphate competitively inhibits cellular enzymes that are needed for the synthesis of guanosine triphosphate and nucleic acid. Ribavirin triphosphate also competitively inhibits the viral mRNA synthesis. It is administered by oral, aerosol or intravenous route. It is metabolized in liver and excreted in urine. Ribavirin is effective against a wide range of RNA and DNA viruses. It is used to treat influenza, parainfluenza, measles, adenovirus, and respiratory syncytial virus infection. Oral ribavirin is effective in the treatment of chronic hepatitis C infection. Adverse effects. These include nausea, tiredness, cough, dyspnea, anemia, and insomnia. Conjunctival and respiratory irritation may occur on aerosol therapy. Ribavirin is contraindicated in pregnancy and childbearing age because of its teratogenic, mutagenic, embryotoxic, and gonadotoxic effects. Thank you.